So there's obviously a great deal of excitement on immunotherapeutics. In the context of glioblastoma, the mechanisms that the tumor uses for immunosuppression are very different, very heterogeneous. It means that there's multiple redundant mechanisms. Right now there's a great deal of enthusiasm on things like immune checkpoints, but we think that there's only going to be a subset of patients that are going to respond. We therefore are going after key targets or key hubs of tumor-mediated immune suppression. So particular pathways or mechanisms that actually deal with more than one particular mechanism of immune suppression. In the case of FGL2, this is a secreted protein that glioblastomas make, and what this does is it actually exploits multiple mechanisms of immune suppression to stay behind the detection of the immune system. So it specifically increases T regulatory cells, which is known to sort of inhibit those immune responses. It also induces what's known as the M2, or the tumor supportive macrophage. It also recruits what's known as a myeloid-derived suppressor cell. So it's not just working on, let's say, immune checkpoints, it's also working on these other cells that are also contributing to the tumor-mediated immune suppression. We think this is going to actually impact more patients because it actually hits more than one mechanism. And we additionally think it's going to have a more profound impact, because what we find is that if we hit one target, immune suppressive target, that other immune suppressive mechanisms become upregulated. So we think getting at these really sort of these hubs is really going to be important for the heterogeneous tumors that don't exploit one particular mechanism all the time consistently.